Over centuries, many of the major advances in public health have been achieved through medicine. Pharmaceutical interventions cure, heal, and prevent disease in the human body, as well as improve and maintain our health. As custodian of all medicines, the pharmacist is one of the most important professionals in the delivery of health services. Pharmacists are the health professionals who have the most detailed knowledge of medicines and how they work. We depend on them to ensure the safety and efficacy of the medicines used by the public. While we mostly encounter pharmacists who dispense medicines, there are many pharmacists who work behind the scenes, beginning long before the medicine reaches the patient. The control of medicines is the responsibility of the Medicines Control Council. Its main purpose is to safeguard and protect the public by ensuring that all medicines registered in South Africa are safe, therapeutically effective, and that they consistently meet acceptable standards of quality. This control also extends to the storage and dispensing of medicine and the employment of appropriately qualified personnel. The manufacturers must submit proof of safety, quality, and efficacy when applying for approval and registration of a medicine for use in South Africa. A summary of this information is contained in the package insert, such as the scheduling status, composition, action and classification, indications and contraindications. To a large extent, the systems of control implemented by the MCC have protected consumers in South Africa from the magnitude of counterfeit medicine problems that many other African countries encounter. The public can assist by buying medicines only from a trustworthy source, such as your pharmacy, and not from unlicensed vendors. The control of professional practice standards is vitally important in the whole pharmaceutical industry. The South African Pharmacy Council is a body which is committed to serving and protecting the public. It does this by setting standards of education and practice for pharmacists and by monitoring that these are effectively implemented. All pharmacists are required to be registered by this organization and to adhere to the defined standards and regulations. They are required to participate in continuing professional development to stay up to date and competent in their profession. The educational qualification and schools are inspected on a rotational basis to ensure that standards of training required in the profession are maintained. The Council sets standards not only for pharmacists, but also for the management of any pharmacy, according to standards set out in the Good Pharmacy Practice Rules. These Good Pharmacy Practice Rules apply to all pharmacists and pharmacies, which are inspected regularly by Pharmacy Council to ensure that you receive the best possible pharmaceutical care. With the growth of the World Wide Web, internet pharmacies registered in South Africa are also subject to the same rules and are required to comply with the South African Pharmacy Council's stipulations. In 1996, the South African Bill of Rights gave every member of the population the right to access health care, and later in 2005, the Patients' Rights Charter guaranteed the standard of service that a patient may expect at any health facility. These rights include access to health care, participation in decision-making, and patient confidentiality. In respect of our public's rights, every pharmacist must adhere strictly to the Pharmacy Council's Code of Conduct and deliver the health care promised by the profession. There are many ways in which the pharmacist adds value to your health care, but as a patient, you are also pivotal in the quality of health care you receive. To enhance quality care, consumers can start by taking responsibility for themselves and for their health. You have a right to understand everything you need to know about your medicines. Your pharmacist can answer your questions, guide you in your pharmaceutical and health choices, and contribute to your wellness. Together, we can strive towards quality pharmaceutical care to achieve good health. Your pharmacist knows. Your pharmacist cares. Ask your pharmacist.